Urinary tract infection. Yes, always it is believed that women are the people who are prone to urinary tract infection, and it is true. But what I want to say today is that men can also get urinary tract infection or UTI. And what can make a man get urinary tract infection? Because women is 30 times more at risk of getting urinary tract infection than men. So let us talk about urinary tract infection in men and some of the signs and symptoms and what can really make a man get urinary tract infection. So urinary tract infection in men, okay, what if we just talk urinary tract, what does it include? Okay, urinary tract include the part of the body that make urine and carry it outside the body. That is what we call urinary, the part that makes the urine and carry it outside the body. For men, this part include the kidney, bladder, as well as the ureter and urethra. Urethra are the tiny tube that carry urine from the kidney to the bladder. Urethra is the single tube that carry urine from the bladder past to your prostate and then to the penis. So if unhealthy bacteria build up anywhere in your urinary tract, this can cause an infection. And urinary tract infection are much more common in women than men. This is because of the anatomy of the women. So we have two types of urinary tract infection. We have the upper urinary tract infection and the lower urinary tract infection. So the upper tract infection is one that happen in the ureter and the kidney, and the lower tract infection is the one that happen in the bladder, prostate, and the urethra. So I think today you have known that not every time you will have lower urinary tract infection or upper urinary tract infection. You can have either of one or both. So what are the signs and symptoms of urinary tract infection in men? Depending on the location of urinary tract infection, you may have one of these that I'm going to list. And yeah, you may have one of these that I'm going to list. Number one is frequency or frequent bathroom trip. You go to the toilet 20 times a day, and even after urinating you still feel like you still have an urge to go and urinate. Even if you go and urinate, you will still get an urge. So we'll have frequency and we have the urgency. The third point, we have pain or burning or discomfort while urinating or peeing, or just after you finish urinating, you can have pain or burning sensation or discomfort. The next point, you can have pain or tenderness below the stomach. Yeah, you can have pain or tenderness below the stomach or on the flank. And then the next point, somebody can have bedwetting. Someone can have or can present with cloudy or smelly urine, and also someone can have blood in urine or can present with blood in urine. The person might have fever and nausea or vomiting. How can you diagnose this urinary tract infection? The diagnosis depends on the signs and symptoms, and also if the doctor wants to confirm if you are having prostatitis or any other condition related to urinary system, you will be sent for a scan. And to confirm the bacteria, you will go for urinary test or urinalysis. Yeah, those are the diagnoses that maybe you can be sent for. Treatment, urinary tract infection, if it is just urinary tract infection, it's usually treated with antibiotics. I'm not going to pronounce those because I know you will go and buy them. So it is usually treated with just antibiotics and maybe painkillers, or yeah, antibiotics and maybe painkillers. If you have nausea and vomiting, we can give you anti-nausea drugs that can, let me say antiemetics. Yeah, we can give you antiemetics. If you have nausea and vomiting, we can give you antiemetics, antibiotics, and the painkillers or analgesics. So untreated urinary tract infection can lead to kidney infection, and also you can have sepsis. Yeah, you can have kidney infection and sepsis, and also you can have blockage. Yeah, and you can have also a chronic pain or acute pain most of the time. So what can really put a man at risk of getting urinary tract infection? Number one, if this man is having diabetes lower immunity and put you at risk of getting infection. If you are suffering from kidney stone, if you are having kidney stone, you can have urinary tract infection. Enlarged prostate can also put a man at risk of getting urinary tract infection, because there will be a blockage of flow of urine, and this accumulation of urine in the bladder increase high chances of getting infection. And also in some people who have, those who have men who are uncircumcised, those who have not been circumcised are at risk of getting urinary tract infection, because accumulation of bacteria on the uncircumcised foreskin. And next one is those who are using antibiotics that kill the normal flora of the body can also be at risk of getting urinary tract infection. Hygiene is a cofactor for men. If you are not practicing hygiene as you're supposed to do, you can also get urinary tract infection. Another thing that can make a man have urinary tract infection, if this man is having some of the sexual transmitted infections, such as chlamydia and other sexual transmitted infection, this man can also suffer from urinary tract infection. And any blockage along the urinary tract can also put you at risk of getting urinary tract infection. Also, when your partner is having urinary tract infection and has not treated the infection, you can put your man at getting urinary tract infection. I think I've exhausted urinary tract infection in men, and therefore I think I will reach there, and yes, I will reach there and I will stop from there. So I will only remind you to subscribe, like, share, comment, turn on your notification bell. Why have you not subscribed and you are watching this content? Subscription doesn't cost you anything. Just subscribe. A lot of people are watching this content and they have not subscribed. Kindly subscribe. You are supporting me and you are supporting my content. So just kindly subscribe to my channel. You can correct me. You can comment whatever you want to tell me. We can speak in the comment section. And also follow me on other social media, Instagram, TikTok, Facebook. We have the same name, Stacia Mbroka. So I think I've reached the end. I'm going to stop there, and let's meet in my next video. Bye.